The life-threatening alpha-gal syndrome food allergy is also known as the red meat allergy or tick bite meat allergy. The Lone Star tick is a vector for the alpha-gal allergy in the United States of America. The Australian paralysis tick is a vector for the alpha-gal allergy in Australia. Photograph of urticarial eruption in a patient with alpha-gal related red meat allergy. Alpha-gal is the common name for the galactose alpha-1,3-galactose oligosaccharide sugar found in most mammalian meat and derivative foods. This sugar is not contained in birds, fish, reptiles, or people. It is present in meats such as beef, lamb, pork, rabbit, and venison, as well as in cow's milk and its other products and gelatin. An oligosaccharide is a molecular carbohydrate composed of a small number of sugar monosaccharide units. Alpha-gal syndrome, AGS, is a potentially life-threatening reactive allergic tick bite-associated immunoglobulin E-mediated hypersensitivity reaction to the sugar upon consumption of the aforementioned mammalian-derived comestibles by susceptible individuals. Ticks are wingless, blood-sucking, parasitic insects that attach themselves to warm-blooded vertebrates to feed and function as infectious disease vectors. Biting tick saliva containing alpha-gal is injected into the bloodstream of the host. The host's immune system reactively releases immunoglobulin E antibodies to this antigenic foreign sugar. Subsequent comestible intake of alpha-gal containing mammalian substances are causative of a typical allergic immune reaction. Anaphylaxis consists of a generalized or systemic immediate type 1 hypersensitivity reaction, whereby this specific antigenic or hapten exposure of a sensitized individual may result in angioedema, pruritus, and urticaria, with subsequent vascular collapse, as well as shock and often life-threatening respiratory distress involving multiple organ systems. Anaphylactic agents include certain foods, drugs such as lidocaine and penicillin, heterologous enzymes and hormones, pollen extracts, horse and rabbit sera, and Hymenoptera venom. Alpha-gal syndrome symptoms include cough, shortness of breath, breathing difficulty, blood pressure decrease, dizziness or fainting, heartburn or indigestion, diarrhea, hives or itchy rash, nausea or vomiting, severe stomach pain, and swelling of the eyelids, lips, throat, or tongue. Mild to severe symptoms appear between 2 to 6 hours after exposure to alpha-gal containing comestibles. Alpha-gal syndrome is clinically difficult to diagnose. Alpha-gal syndrome treatment involves antigen avoidance and treatment of specific symptoms upon accidental exposure. Rescue medications such as antihistamines or an epinephrine adrenaline injector are used to specifically treat severe life-threatening anaphylactic symptoms. Alpha-gal syndrome acquisition, allergic reactions, and manifestations illustration. Signs and symptoms of anaphylaxis. Swelling of the conjunctiva, runny nose, swelling of lips, tongue, and/or throat, heart and vasculature, fast or slow heart rate, low blood pressure, skin, hives, itchiness, flushing, pelvic pain, central nervous system, lightheadedness, loss of consciousness, confusion, headache, anxiety, respiratory, shortness of breath, wheezes or stridor, hoarseness, pain with swallowing, cough, gastrointestinal, crampy abdominal pain, diarrhea, vomiting, and loss of bladder control. Alpha-Gal syndrome reaction skin manifestation. How to check your body for ticks illustration. Checks your clothing and body for ticks after being outdoors in grassy, brushy, or wooded areas where ticks live. Check these parts of your body and your child's body for ticks. In and around the hair, in and around the ears, under the arms, inside belly button, around the waist, between the legs, back of the knees. How to safely remove a tick. 1. Use a pair of pointed tweezers. 2. Grasp the tick by the head or mouth, right where it enters the skin. 3. Pull firmly and steadily upward. 4. Place the tick in a small container of rubbing alcohol to kill it. 5. Clean the bite wound with rubbing alcohol or hydrogen peroxide. 6. Monitor the site of the bite for the next 30 days for the appearance of a rash. 7. If you develop a rash or flu-like symptoms, contact your healthcare provider immediately. New presentations coming soon. Thanks for watching. Thank you to current and new subscribers.